Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. And I'd like to say hello to everyone out there who is new. Go ahead and introduce yourself down in the comments. Tell us where you're from. Tell us, are you here to learn about kidney disease to help a loved one or somebody you know, or is it for yourself? Now, for those of you that are new, let me quickly introduce myself. My name is James. I am the creator of Dadvice TV, and I happen to have kidney disease too. I found out that my kidneys were not doing too good just a little over 2 years ago when I spent a week in the ICU and discovered what stage 5 kidney disease is. Now, doctors told me I need to go on dialysis, but I said, Doc, let me try a few things. I worked on my diet. I started exercising a lot more. I got my blood pressure under control. I started eating so much better, working with renal dietitians, and I improved my overall health. And more importantly, I improved my kidney health. I am now stage 3, feeling great. Not a single symptom holding me back from doing whatever I want. Now tonight, we're going to talk about an important part of that being healthy, getting your whole body healthy. We're going to talk about vitamins. Matter of fact, for the next few weeks, our co-host, Renal Dietitian Jen Hernandez, and I are going to be talking a lot about different types of vitamins and which ones kidney patients need to watch out for, which ones we probably need to keep an eye out for, and which ones we really need to pay attention to. Now, tonight, we're going to start talking about vitamin D and the fat-soluble vitamins. And if you don't know what those are, don't worry, because Jen, our co-host, is going to explain that to us. Now, let me bring Jen on here. It is Tuesday. When it's Tuesday, Jen is here, an actual real renal dietitian, sharing her incredible experience and knowledge. Let's all welcome Jen. Hey, Jen.
Hi, James. Hey, everybody. Yes, I'm a real live dietitian, a real live renal dietitian here live with you all this Tuesday evening. And I am so excited. I know vitamins is such a huge conversation, a huge topic that a lot of people have questions on. So I'm really thrilled to start to bring you all this multi-series chat where we're going to dive into a lot about the vitamins, and hopefully by the end of all of this, you're going to feel a lot more confident in really understanding what to pay attention to with your vitamins and what you can ignore, essentially, when it comes to vitamins for kidneys and for your kidney health. So I'm absolutely thrilled. For those that are brand new to Dadvice or have maybe never seen me on the show before, my name is Jen and I am a renal dietitian. I help people with chronic kidney disease make the most of their diet, following a plant-based diet to keep their kidneys healthy, functioning, and delay or prevent dialysis for as long as possible. I run the website plantpoweredkidneys.com, and I also have created the Facebook group, which many of you know of, which is the Plant Powered Kidneys Facebook group. And this is a free community. It is private, meaning not everybody sees what's going on unless you're a member in the community. And it is a really strong, welcoming, supportive group of kidney warriors that are all looking towards following a plant-based diet for their best kidney health. So if you haven't found us on Facebook yet, I really highly recommend that you look us up. Just search Plant Powered Kidneys on Facebook and we will pop up in the groups. And it is absolutely an honor to go through and check in with everybody there. And I mean, James, it's such a wonderful group.
So helpful, so supportive. And for many of you out there, you may be wondering, what can I eat? It looks like I can eat nothing. Things are going to be bland and boring. No, that's completely wrong. And in Jen's group, Plant Powered Kidneys, you're going to learn all sorts of recipes that other people share, ideas to help add some zing and some variety to your food, and you're going to start loving eating again. You're not going to see it as something bland and boring. You're going to see it as an opportunity to explore some new flavors, some new mixtures, some new textures, and keep getting healthier.
Yes, absolutely.
All right, so tonight's topic is a very important one, and this is one there is a lot of confusion about, and it's something that so many kidney patients, me included, when I was first diagnosed, I started thinking, I probably need some vitamins. There's certain ones that probably are going to help me. I heard about them on TV. I know other people take them. You see those ads, and the people who are riding horses and playing tennis into their 80s and 90s are all taking vitamins. Maybe I need to take those. But my doctor told me, hit the brakes, James. When it comes to kidney disease, you need different vitamins, and we need to look at your labs to kind of figure things out. So, taking vitamins was an important part, and still is, of my overall health. But we can't just run out to the store, grab a bottle of Centrum. We got to understand what vitamins we need and what they do for us. So let's kind of take a step back. What the heck are vitamins and minerals to start with?
Yeah, sometimes it's kind of hard to imagine really what they are because they're so intangible in a sense. They're hard for us. We know of foods that have them, or we know that they're good for us, but really what are they? Essentially, they are these organic substances that come from our food, that come from nutrients, and our body uses them to create energy, but they don't actually contain energy. And when I say energy, I'm talking about calories, the stuff that really gets us going, the gas for the engine. So the vitamins and minerals don't directly give us the energy, but they're part of the engine. They're part of the whole system to make sure that we use the energy that we do eat, the calories, the fat, the protein, the carbohydrates, all those macronutrients, and we use those appropriately in our bodies. Vitamins, minerals take care of an insane amount of responsibilities in our body. And the more we talk about the vitamins, it becomes more and more apparent about how much they do for us without us even realizing it, because they're just kind of in the background and they're not the main component of our diet. They're not the things that we really always think about, but they're always there. They're always present and relevant and part of the solution. But like James mentioned, that it's not as simple as just running out and grabbing the first kind you see, or jumping after the first commercial that you see, or even worse, some of the tricky marketing ads, the things that are really eye-grabbing and the term clickbait, those kind of headlines that you're like, oh wow, this sounds so important for, kidney health, my must-have kidney vitamins, that kind of stuff that they just want you to click and buy their stuff. You got to be careful about that because it's not always the case, and it's always so important to clear all of your vitamins, all of your supplements with your doctor first to make sure that you're not doing any damage, because even though vitamins and minerals sound like a great idea, that's not always the case, and those extra supplements can actually do the exact opposite of what you want them to do.
Exactly. And what are the two types of vitamins that they fall? We talked about that we're going to be doing fat-soluble, but what does that mean, and what are the two types?
Yeah, so there's water-soluble and fat-soluble, and those are the two types of vitamins, and then there's minerals, which will be a different category that we'll discuss. So tonight we're going to focus on the fat-soluble vitamins. These are vitamins that actually require the fat that we eat to help absorb and to be utilized in the body. One of the reasons that I am not an advocate of an oil-free diet, because of how important oils and healthy fats are for the body, because these vitamins, they think of the soluble as in they dissolve, or they are a solution in fat. So we need fat in order to take on these specific kinds of vitamins that we're going to dive into.
Yeah, and so many fats are good for our health. The whole anti-oil thing, I don't know where the heck that came from. I think it's somewhere with the flat earthers. So how do I know if I need to take some vitamins to help my kidneys?
So In many cases, especially with chronic kidney disease, there is a higher chance of having some deficiencies, some malnutrition involved, especially as we talked about the idea of I can't eat this, I can't eat that. It just really starts to look like Swiss cheese of an idea of what our diet is, with so many holes in it. And when we have these holes, we increase the risk of deficiencies because we're pulling back on a lot of things that are really rich in certain nutrients, including these kinds of vitamins. So you want to make sure, especially if you are on dialysis, that you discuss taking vitamins with your nephrologist, because dialysis is a whole process that also does increase the risk of deficiencies. And most people, I'm not going to say all, but most people on dialysis, from my experience, really benefited in a renal multivitamin, specifically a vitamin that is formulated for the kidneys. So you and I, James, have talked about ProRenal, and that's an example of a
focused
vitamin that is meant for kidney health.
There we go. Yeah, it's missing the things that we don't need that could build up and cause some problems. And you know, and that's the key reason why we just can't run out and grab one off the shelf. Now, what if, and you know, of course, we've all seen the ads, we've seen the videos out there promoting all these herbal supplements. Can't they fill in the gap? And so we don't need vitamins?
So, I mean, we did a whole other episode about cleansing the kidneys and this whole idea of these remedies that will repair your kidneys. And that's just not the case. And again, like James and I have said, if there was a cure like this, if there was a solution, we would all be screaming it from the rooftops. And
exactly.
We wouldn't stop talking about it.
I'd have no kidney issues if there was a cure, because I'd be taking it.
Exactly. So you definitely want to be careful with any kind of herbal remedy or herbal solution or whatever the case is. I have spoke before about how some herbal teas are okay. And in those cases, it can be fine. You want to be careful about the ingredients. I don't want to go too far down that rabbit hole, but the topic herbal, it's just a huge umbrella of terms and concepts and ideas. So we might say certain things are going to be okay, and then certain things won't be so okay. And then there's going to be some things that just aren't studied enough, and we can't say yes or no. But when it comes to CKD, usually as practitioners, we're on the cautious side because it hasn't been studied enough. And y'all aren't guinea pigs. So we're not about to say, sure, let's just see how it goes. So we get very cautious with a lot of the things that we just don't know enough about.
Yeah. Now, are there any certain vitamins that actually help the kidneys, that if I take this one, it will repair something? And is, you know, kind of leading on to that, if I take some vitamins, can I take too much?
Oh yeah. I mean, there's absolutely a chance, 100% chance, especially with the fat-soluble vitamins. That's going to be a big part of the chat tonight, that there is such a thing as too much of a good thing, and that can lead to really serious health problems that we'll dive into. But there's really no one type of supplement, vitamin, whatever you want to call it, that is going to solely focus on kidney health. There are some that are more commonly recommended and more commonly focused on, like the very first one that we're going to be diving into tonight, which is vitamin D. That is something that is really commonly discussed when it comes to kidney health. And we'll talk a little bit more why that's important. But there is still such a thing as too much vitamin D when it comes to kidney disease and kidney health in general. So it is something that you can't just think of a more is better kind of concept, because there's really very, very rarely in the CKD world is there anything that's going to apply to that idea.
Yeah. So vitamin D is one that we, you know, as kidney patients, we all should have heard about. There's a specific test just for it. It's common for kidney patients to not have enough of it. So what the heck does vitamin D do, since it is so important?
So vitamin D is really about our bones. That's the primary focus, is that vitamin D helps us with calcium absorption. So, I mean, I don't know about you guys, but I remember the commercials that I used to see when I was a little girl talking about those calcium chews and how they were so good for women because women had a risk of bone fractures and low calcium levels. And they said, take these vitamin D chews. And that was one of the first supplement commercials I remember seeing on TV and like really remembering it. But vitamin D is really all about the bone balance, and your bones are always changing. It is like construction in, I'll say Tucson, where I'm from, my hometown. It's like construction in Tucson. It just never stops. There's always things being built up and taken down, and that's the way our bones work. So vitamin D helps in pulling calcium in, but because of that calcium balance and pulling the calcium in, that's also where the balance comes in play, and the idea of there is such a thing as too much vitamin D.
Yeah, and then since it is related to calcium, I'm guessing our bone health is why vitamin D is important for kidney patients. Is that correct?
Yes, people with chronic kidney disease will have a higher risk of bone fractures, bone breaks, vitamin D deficiency, because part of the process, well, first of all, let me say the liver is what helps convert the fat soluble vitamins. So the vitamins we're talking about tonight, the liver is part of that process, that our body takes the vitamin from how we eat it or absorb it through our system to actually use it as essentially a type of hormone. So vitamin D goes through and gets converted from the skin through the liver and then through the kidney into the active hormonal vitamin D. But in this process, this is where it can end up building up and becoming an issue because of essentially trying to take too much, thinking that we need a lot more of it because of the kidney damage. But a lot of people with kidney damage do need some type of vitamin D supplement. Now, the amount that you need will be very different for each person.
Mm-hmm.
And I always advise that you get your nutrients tested. There are companies like SpectraCell, Vibrant. There are several lab testing companies out there, many of which will require a physician order. So even if you try to go around the doctor to get them tested, they might still need to go through your doctor. But start with your doctor and just ask for a micronutrient lab panel and get your values tested first. And then you can even assess to start with and see if you need to worry about any deficiencies. I mean, that's a really good starting off point for you to find out if it's something that you need to be looking further into.
Yep, and your labs are your best roadmap to help you figure out how much of things you do or don't need. So it's always a fantastic way to figure it out. We've said this before, but I want to repeat it here. Just because somebody else takes X amount of something doesn't mean that's right for you, even if you are the exact same GFR. No, it's all very, very different. As a matter of fact, I take a lot of potassium in my food, and you guys may be thinking like, whoa, James, kidney disease, potassium. My body's really unique that I can't hold on to it, so I have to consume more of it, where if someone duplicated my diet exactly, they could be in trouble if they don't need that extra potassium. So always check with your doctor for how much of these things you need. Now, vitamin D, there's a lot of different places we can get it. The sun is the one we think about the most. And right now in winter Ohio, there's not much of that right now. If I wanted to get food with vitamin D, what are some sources for me?
Well, one of my favorite sources would be mushrooms, which are kidney friendly. Absolutely something that can fit into a renal diet, but you want to make sure the mushrooms are notated on the packaging that they've been treated with UV light. That's what will give the vitamin D. The amount of vitamin D is from that UV light treatment. It's not always common. You might not always be able to find it. So don't beat yourself up if you can't find it there. But I do love that it's a plant source. and they just treat it with, they put it in their little mushroom tanning beds, and it gives a ton of vitamin D. Like about half of the vitamin D for the day will come from those UV, just a half a cup of those UV treated mushrooms. So that's one of my favorite sources. Another option is a lot of the milks, which we did do a whole other episode talking all about milk for kidney disease. And there are milks that are fortified with vitamin D. So if you have a milk that has some kind of labeling on it about the vitamin D there, that's going to be another source of vitamin D for you. Now, getting into the other side, the animal products, which some people with kidney disease can, and in some cases should have, for their own health. Again, this is very individualized at this point, but there are some people that do need to have animal proteins. Salmon is a good source. Sardines are a good source. And if you think about sardines, that one really, to me, makes sense. Yeah.
I'm not a fish person. Salmon, my wife loves. One day I'll try it. But sardines, just the thought of it.
Do you like Caesar salad?
I know that there is sardine paste in the dressing, yes.
Yeah.
But it's small amounts.
That's true. That's true. Well, sardines, because they're such a small fish and we don't actually debone them, it's the bone. And again, you guys, like, calcium is stored in our bones, and that is that whole vitamin D, calcium, bone balance, I would say. That whole thing. Sardines are going to have a good source of vitamin D in there as well. Another option is eggs. Eggs do have vitamin D, so that's another option for you. But many people do still need, even with eating sources of vitamin D, many people do still need a vitamin D supplement. But again, you're only going to know how much if you get your vitamin D level tested, and then you continuously review that with your healthcare team. That's something I tell all of my clients. Even though we talk about the recommended vitamin D level for them, and I help give them the right dosing of their supplement, it's not a set it and forget it kind of thing. You have to routinely check it. So getting your vitamin D levels tested at least twice a year is going to be really, really helpful.
Yeah, we have a number of people who are on the pro sardine side.
Oh, well, that's cool.
I still got to try mushrooms. For those that remember, maybe a few months ago, I did buy one of those big mushrooms, but I let it sit in the fridge too long, and I'm sure I did not prepare it too well. One day, when the lockdowns are all done, I'll go and I'll eat one somewhere that knows how to make it. Now, when it comes to D, I know that there's D2 and D3. I see those when I'm at the store looking at vitamin D, because I take vitamin D, and my doctor has me take D3. What's the difference between those?
So these are a different type of basically where the vitamin D is. It's essentially a vitamin D pathway, which if you guys do want to Google, you can search up some images, plenty of images about vitamin D pathway, and it'll show you how it goes from the skin to ingesting it to the liver, to the kidneys, and all of that. So these are two different types of the chemical structure, basically, of the vitamin D. Vitamin D2 used to be more common, but now they're finding that vitamin D3, that type of vitamin D, is better absorbed, and it has been shown to improve the serum vitamin D levels in your blood test better than vitamin D2. The other thing I'll add there is really that's becoming even more common as well is the Cofactor K2, and that's another organic compound. Basically, I mentioned how the vitamins help with the macronutrients. The cofactors help with the vitamins. So think of it like a food chain, essentially.
There we go.
So the Cofactor K2 helps with the D3, balance the calcium, essentially telling the calcium where it needs to go to the right place. So it's really being a part of the supportive process in managing that overall goal with vitamin D, which is calcium balance.
Now, there's also active D.
Hmm.
And is that something I can take in a pill, or is that what my body creates from the D that I am taking?
There is a pill form. There's also an injection form. So many, if anyone here is on dialysis, you might have the active form of vitamin D. It's also called calcitriol. That was the one that was most common in my clinics that I've worked in. There's other names for it, Hectorol, Zemplar. These are a type of the active vitamin D hormone, but it's by prescription only. So this is not something that you can find over the counter, but it is very, very common for people on dialysis that need to take care of. Usually, specifically, it helps with hyperparathyroidism, which it's not hyperthyroid, it's hyperparathyroid. It's a different gland in next to your thyroid, para, but not the actual thyroid.
Now, I remember reading something about a type of diuretic in vitamin D that work
So
together for something.
So the thiazide diuretics, which we have gone through, we talked about them, I think it was last week a little bit, with the kidney stones as being one of the commonly prescribed medications. So the thiazide diuretics, they also help with, they decrease the amount of the calcium that is released. So basically keeping the calcium in your system. So if you're taking a thiazide diuretic and you're taking a vitamin D supplement, that is prescribed or that is at least overseen by your healthcare team, you might have a higher risk of developing hypercalcemia, which is high calcium levels. So it's really important that this is one of the reasons why you want to clear even something as thought to be as simple as a vitamin D supplement with your doctor, because you just don't know how it might interact with other medications that you have on board already.
Yeah. And what about vitamin D and phosphorus? Are there any concerns there? Since, we have to be really careful with phosphorus in our diet. It's pretty much one of the most abundant things in our body.
It is, yes. It's actually the most abundant mineral in the body. That is the number one source, and it's stored in our bones. So, again, if you think about this idea going back to vitamin D and what it does, vitamin D helps with calcium absorption and getting enough calcium into the body, getting enough into the bones. If phosphorus is also stored in the bones, there is this connection with the phosphorus balance with vitamin D. It's all coming back, all regulated or being tied in together regarding your bone health. So that's another thing that's really important to be aware of, because it might play an effect on how your phosphorus levels look if you're taking too much, or on the other side of things, if you're not taking enough, or if you have the overactive parathyroid, PTH. That could also be something that also plays a part in that whole imbalance.
Good to know. Now, you mentioned one word a little bit earlier that always makes me cringe: kidney stone. Can
Mm.
vitamin D cause those painful kidney stones?
So we talked about this a little bit last week. Again, trying to keep track of time. um, so we talked about this last week with kidney stones and how vitamin D in an excessive amount can possibly increase your risk of kidney stones. In general, the studies that have looked at vitamin D alone with kidney stones, they're not seeing a correlation with that. But for people that already have kidney stones, there is a potential risk of that being connected. It's just really hard because the studies are not always filtering or focusing on chronic kidney disease as well. They're looking at just vitamin D and kidney stones, which in of itself can be helpful. But if you have kidney disease, you can't always take a study like that to say, oh, that means that this will or will not apply. So there was one study that showed people who took a very, very low amount of vitamin D didn't have any correlation with kidney stones. But it also didn't talk about chronic kidney disease or any history of kidney stones either.
Mhm.
So it was just saying directly that if a normal person with no health conditions took vitamin D, they're not going to see a risk of kidney stones there.
Yeah, well, I'm always very careful, staying hydrated, drinking plenty of water. Look at that.
You
It's
just
late
reminded
in the
me, yeah.
day, and I'm bottom of my third thing here. I'm pretty much round the corner of the amount of fluid I need for the day, according to my doctor. In case anyone out there is new and they're like, how much fluid do you
Yeah,
need? Your doctor will tell you.
it's what your doctor tells you.
Exactly. And not Dr. Google and not Nurse Facebook. It's your doctor. Now, for a healthy person, what is the recommended intake for vitamin D?
So it's about for an adult. This is just an adult from 19 to 70 years old. We're looking at about 600 IUs, which is international units. That's typically the way you'll see vitamin D supplements listed. That will be the adequate intake. And adequate means it's enough. It's enough for the body to utilize and for things to be running smoothly. So 600 IUs it sounds like really low because it is pretty low. It's not a significant amount. That in
Yeah.
part is why it's considered a micronutrient and not a macronutrient, because it's small. We don't need very much of it for it to do a good job. So it's something that, again, with chronic kidney disease,
Mhm.
people do tend to have a higher risk of the deficiency because, again, that kidney pathway with vitamin D, if the kidney function isn't there, it might not be able to convert it to that active potential or that active vitamin D.
Yeah, and for those that are not aware of it, your doctor will do labs, and I believe it's between a 20 and a 50 is the range they want the vitamin D to be, or a 30 and a 50. There's
Yeah.
a range in there which will let you know if you're, where you are, or if you're a little bit
Hmm.
low. And your doctor will set your target. Mine happens to be above the 50.
Yeah.
My doctor, based on my health, all my goals, everything else, my personal target is 80, and that's what my doctor set for me. But that's, for me, it may not be the same for everyone else.
Right.
And I take to keep up to that a lot more than that 600 I use a day. I take some
Yeah.
every day, and then every week I have an additional amount that I take. And that fluctuates. When I get my labs, my doctor looks at where I'm at and says, okay, here, I want you to reduce your weekly vitamin D to this. So that's kind of
Hmm.
how it all works out for anyone out there who is new. Is there any issues like upset stomachs or anything I need to be worried about if my doctor says, hey, you need to take X amount of vitamin D and it's more than that standard, 600 units? That is so low. I can't believe that.
Yeah. Yeah. Well, again, a micronutrient. So,
Yeah.
not too much. With taking too much, there typically isn't going to be any kind of immediate physical reaction of having too much vitamin D. The first thing that will be noticed is probably a high calcium level. When that becomes imbalanced, again, because the vitamin D is helping to pull calcium in. So if you're taking too much vitamin D, you might be absorbing and holding on to more calcium. So that might be the first sign, but that's a lab and that's not necessarily going to be a physical sign of it.
Mm-hmm.
What could happen down the road, and this is one of those things that can take like years. It can take a long time to have physical manifestations, but essentially if you pull in too much calcium and if you have problems with phosphorus as well, these calcium and phosphorus components will bind together and create these little crystals that start to
Yes.
settle in your soft tissues. And that's where you get a lot of the itchy skin. Some people get redness around their eyes. Sometimes they get little dots even under the eyes, or dots on the skin, like little bumps, and that is
Yep.
essentially the extra minerals that are collecting in the soft tissues. And that is what can lead to a myriad of problems down the road, including the term calciphylaxis, which is a horror story to look up. If you want to do any doctor Google search, calciphylaxis is a nightmare. Like, it is a scary, scary show. So that is something that we want to prevent, and part of that has to do with their calcium and phosphorus balance. But again,
Yeah.
this is over a long period of time.
And for anyone out there who has experienced the itchy skin, if you're a kidney patient and you start getting itchy skin, that is something to let your doctor know. Shoot them an email, give your family doctor a call, and just say, hey, I've got this itchy skin. It won't go away. It could be dryness. It's winter, we got the heat on, or it could be a sign of something a little more serious. I often see people talk about it in message forums, and they'll even post pictures, and I see the little red dots. I know, oh, that's probably your calcium, D, phosphorus, those levels are off. That's most likely what it is. And they're looking for creams to cover it up. That is not the right thing to do. No. It's go check with your doctor. They'll do labs. And if your phosphorus is out of whack, you can probably adjust it with your diet, or they'll work with you and you'll be able to take care of it and eliminate the problem instead of just trying to cover it up and let it, keep getting worse without you knowing.
Yeah. There's some medications that will help the symptom, and there's some medications that will help the cause or the problem. And that's what you want to differentiate. And that's where your healthcare team comes in, is to help not just cover the symptom, but to solve the problem. That's what we want to do, is help solve the problem. And the cream, I understand. I mean, I can't imagine, based on what a lot of my patients have told me about their itchy skin, you do want that immediate resolution.
Yes, especially
but you also
at
want
night.
a long term.
You can't sleep, and there's no scratching that makes it go away.
Right, because it's from the inside out. It's not.
Exactly.
It's not a dermal situation that it's starting from a topical thing. It's coming from the inside. It's coming from what's in your body.
Yeah. Now here's a question that was asked a couple times, and I don't know if you know. Pat asked, how much vitamin D do you get, say 15 minutes sitting out in the sun?
So if you sit in the sun without SPF for like 10 minutes a day, you can get the adequate amount of vitamin D. It doesn't take a lot of time for us to get the vitamin D. But again, this is like the first step in that pathway. So even if we go out, because I hear this all the time that people say, oh, I'm just going to go out into the sun longer. That's not the part of the pathway that we're concerned about when it comes to kidney problems. The pathway that we're concerned about is that final step that the kidneys are responsible for doing, which is converting it to the active. So if you go out and get extra sun time, that may or may not be great. We also know there's risk factors involved with getting too much sun, with getting skin cancer and health issues. So it's not always as clear and simple as going out into the sun longer. It's really, when it comes to the kidney health, is taking care of that step. So being out in the sun for 10 minutes or so is typically going to be fine if your kidneys are functioning enough and able to help take care of that part of the process.
Yep. Now, what about the other fat-soluble vitamins that we need to be concerned with?
Yes. Okay, so we also have vitamin A. Vitamin A is, and we did a whole other talk about this. You know what, James? I'm honestly pretty happy that I can say, hey, we talked about this, because we have a ton of resources for everybody, which is really fantastic.
Exactly. And let me plug something real quick. If you guys, when you hear us say, yeah, we talked about that, you can go to dadvicetv.com, go up to the search, and just type it in. Type in phosphorus Jen. You'll see the videos that we've done. I mean, there are a ton of them, lots of great information out there. So that's a great way to learn about these things that we spoke about in the past. And for those that are new and you're wondering what to eat, I've seen a few questions there where people are kind of surprised that, hey, I could eat some animal protein, have a little bit of meat. We've talked about that. It all comes down to portion control. But right now we're talking about vitamins, but I just want to mention, hop on over to dadvicetv.com when we're done. Go to the search. I put in an awesome search. It looks at the transcripts of our videos so that it can show you whatever you're searching for. It'll show you the videos related to it. All right, back to vitamin A.
Yes. So we've talked before. We did a whole episode talking about vitamin A, about how it's so important. It is really thought of as the vitamin for our eyes. So we talked about the night blindness. So for people who have a vitamin A deficiency, which is so uncommon, it's very rare, especially in the United States. We do not have a problem getting our vitamin A. But if you do, you might have problems in adjusting in dark rooms or without a lot of light around. And if that's the case, again, it's a good time to talk with your doctor and find out more of what's going on there. So the vitamin A will help with our eye health. It also helps with our immune system in making sure that it takes care of the essentially these oxidants, these free radicals that can cause problems with our health. So the vitamin A is a great thing to include. You guys know there's plenty of sources that are plant powered and kidney friendly that you can include that are vitamin A sources. So I'm not going to spend too much time diving into all of those, but in general, think oranges and reds, even a little bit of the yellows. Think of those like fall kind of colors in our foods, and that's where you're going to get a lot of the vitamin A, and you're going to get plenty of it. There's not going to be a risk of you not getting enough vitamin A in most cases.
Yeah, it's eat the rainbow. That's what I've learned. Before kidney disease, when I looked back, my food was brown. It pretty much came from a drive-through window, and everything was a shade of brown. Even the cheese is not even really yellow. It's fake.
It's a yellow, all right.
It's a form of yellow, but it's more tan. What
it's
about vitamin?
Yellow sometimes.
Yeah. What about vitamin E?
Okay, so vitamin E is basically, I don't want to say basically, because none of the vitamins are basic. They're super amazing sources of energy support for us. Vitamin E is known as an antioxidant. So this is something that is going to help take care of, again, the harmful chemicals and oxidants, which antioxidant, it helps take care of these things that are coming into the body that could potentially cause us problems. So by eating foods that have this vitamin E, the antioxidant, that is going to be really helpful for keeping your body healthy, because you're giving it the nutrients that it needs to fend off the things that it doesn't need. So the places where you can find vitamin E in the diet there's so many different places, but the best source of vitamin E comes from certain vegetable oils. So sunflower, safflower oil, these are two types of kidney-friendly oils. Again, I'm not here to talk about an oil-free diet. I'm here to talk about how good healthy oils can be and how protective they can be of our health. So sunflower, safflower oils are really good sources. If you don't want the oils directly, doing nuts and seeds, which do have healthy fats in them, are also going to be a really good source of antioxidants. So you may have seen some of the commercials about nuts talking about how they're antioxidant powerhouses. Part of this comes in place from the amount of vitamin E that these nutrients or that these foods have in them. So again, tons and tons of places to find vitamin E in our diet. We are not typically going to be running short of vitamin E. So it's not a worry of a deficiency, and it's not really thought of as something that needs to be supplemented.
Yep. And one of my favorite sources of vitamin E, and I'm sure it's a little bit of a shocker for people who are new, who haven't listened to us before, avocados.
Yeah, that's mine too.
I love a little bit of avocado and some salad stuff. I don't eat tons of it. I know a lot of people are new to kidney disease, maybe thinking avocado, that's potassium. Potassium's good for you. Too much is not good for you. We got to watch out for that too much, but it's a great source of a lot of goodness when you use just a little bit of it in your diet.
Exactly.
Now, why is E important for kidney patients?
Well, it's really more about the fact that there's not anything that's showing that there's any link between vitamin E and CKD. So it's possible that vitamin E, when paired with vitamin C, can be protective against kidney stones. There are also some other studies that do look at vitamin E as a possible supplement for certain types of kidney disease. So there are some possible ideas, but again, this is a very new and fresh, and you guys have heard, if you've watched us before, you've heard me say this before, that nutrition science is a very baby science, and that we're looking at CKD nutrition science. And then from CKD nutrition science, we're looking into the different types of CKD and the different causes of CKD and the different health factors associated with CKD, like diabetes and high blood pressure. And we start getting into all these different variables, and that's what makes it a little tougher for the nutritional science to keep up with every single food item, every single nutrient, all these different factors. So we're still looking into it, and it's still being researched, but at this point, there's just kind of starting to get some ideas of using vitamin E potentially to protect against the kidney stones and to help as an antioxidant in some cases.
Yeah, and while we should always let our doctors know what supplements we're taking, any vitamins, and get their approval for it, there are some drug interactions with vitamin E, correct?
Yes, and one of the most important ones would be Coumadin or warfarin. So many people take this prescription medication when you have cardiovascular issues, sometimes with CKD or not, but any kind of vitamin E supplement may interfere with that. And that is a medication, for those of you that do take warfarin, you know that you get your blood tested very routinely, and there's a very tight eye. They look at you very closely for anything related to that medication for your health. So it's really, really important that you pay attention to that. Another one that's really common that a lot of people take is aspirin. So this one also can have a potential effect. And that's why we don't just want to say go for it and take some vitamin E supplements, because you don't know how they could affect your health right now. And your doctor will be able to tell you if it's something that you need or you should take or that you shouldn't take.
Yep. Now, what about vitamin K? I hear a lot about that, especially with vitamin D.
Yes. Yeah, there's a lot of things about vitamin K. One of the things, kind of actually segueing from what we were just talking about with the vitamin E interaction, warfarin or Coumadin, that has a strong connection with vitamin K, because vitamin K actually works as a blood clotting factor. So it helps to take care of when we get a cut or when we have some kind of damage with our blood that it needs to stop the bleeding. It also does help with bone health. And as I mentioned earlier, that vitamin D3 that I see and that I personally recommend more because it helps with calcium more, that K2 is what helps with making sure the calcium goes in the right place. So two of these things are really important and pretty strongly connected to other factors when it comes to not directly kidney disease in a sense. It's not really what we think of right away, but still connected to it. So when you are looking at vitamin K, it's not always something there are sometimes now becoming more common supplements that you can find, but typically it's not something that you need to have all the time or right away, again, because it could interact with some of the other medications that you're taking. But your vitamin D may have vitamin K2 in it already, which many times is what is already paired together to help with that bone balancing and that calcium balancing. So for the foods and where we can find vitamin K, because that's always the good thing to start with, right? Is if I can just
I'd much rather get it in the food than take it in a pill.
Exactly. So some of the top sources for vitamin K are, think of your greens, your leafy greens. I mean, greens we know are just so packed of nutrition with a lot of nutrients. Spinach and kale have a good amount of vitamin K in them, as well as broccoli. There's also pumpkin has vitamin K. And then for the animal proteins, we have chicken and eggs that have vitamin K as well. And then soybean oil is another good source of finding vitamin K in your diet. So there's different types of K, just like there's different types of D. So I mentioned the K2. There's going to be there's K1, there's K2, and then there's like this gut K. And these are the different structures of the K that you'll find in basically this pathway of how it is how it's managed with the body, I'll say. So the K1 is phyloquinone. Oh, man, some of these words, I don't know who decided to come up with these names. Yeah, thank you. Phyloquinone. I think phyloquinone. It's really hard to say, guys. But you want to make sure that that one is essentially the K1. And then the K2 is what is found in the animal-based sources. K1 is from plants, K2 is from animal sources or the supplements, and that is the one, again, that's typically found with vitamin D supplements. And the third one, this gut type vitamin K, there's not a ton that is understood about it. We don't know a lot about it, but we know that this good bacteria, our healthy microbiome, it helps create this vitamin K for us. So this last type of vitamin K is internally made, but we just don't know how much of this we absorb or actually use. So they're still looking into really what that's all about.
Yep. And someone had mentioned, Olivia here, that she has to avoid vitamin K because of interference with her blood thinners. So just like E, we have to be concerned about drug interactions, correct?
Yes, exactly. I have found that, and I need to be careful about this. How am I going to say this? Okay. Okay. Sometimes it's for some practitioners, it might just be easier to say avoid greens or avoid dark leafy greens or don't have salads related to your vitamin K balance because of the blood thinners, where more often than not, it's just about having a balanced amount, having a stable or consistent amount. So it's like, don't just do 1 week where it's all leafy green salads and then the next week there's none, because that's going to change your vitamin K levels so much more dramatically. And when they're trying to titrate or balance out your medication, if you're not being consistent in your diet, they won't be able to balance out your medication. So I just hate it when kind of like the old thought of CKD when they say, oh, don't eat potassium. And it's like, well, I mean, that's not really the way it is.
It's all about getting the right amount and not too much, not completely eliminating.
Yeah. So that's kind of my thought as well with K. And when I hear, because I've had so many patients tell me, oh, my doctor says I can't have salads because of vitamin K. And it's like, that's not necessarily the case. I mean, I've even had clients that are on warfarin and we still have them take the K2 supplement with their vitamin because I want to make sure they're getting enough vitamin D. But it's about that communication with your team and about that monitoring and that balance. So it's not something that's just a matter of giving up green salads, because then you got to think about all the other nutrients you're giving up as well.
Oh, yes. Oh. So what about cooking with fat-soluble vitamins? Anything we need to be concerned about there, or are there some tips to help, get those into our foods?
So in order for the body to take on these vitamins, it needs that fat as a vehicle. It needs that to help with the absorption into the body. So that's why some of the things that I love recommending are like roasting your vegetables with a little bit of oil. Just toss it in a little bit of oil.
Oh, yes.
And that helps give it a great extra layer of flavor. It helps protect it during the roasting process. It's just such a great way to get a little bit, and a little bit of fat goes a long way. You know, when I'm saying that I'm not anti-oil, But it's, again, it's a moderation. It's just, you don't need a lot. A little goes a long way, especially when it comes to oil. So if you have some of those healthier fats, the ones that are monounsaturated or polyunsaturated, those are heart healthy fats, and those are going to provide extra antioxidant benefits for you when you include them, especially with these other nutrient-rich foods like vegetables or foods that do have these vitamins and minerals in them.
Yep. Now, when it comes to, picking vitamins, are there any tips to help us out? Because you go to the store and there's a wall of so many different ones. You go to Amazon, there's tons of them. It seems like everyone and their brother has a vitamin for sale or a combo of them.
Yeah. Well, I do personally have some recommendations on my own website. So if you go to plantpoweredkidneys.com, it's under resources. I have found some through Amazon that I always go directly through the brand themselves. You never want to go through a third-party company. Like, you don't want to go through, like, especially online, just a company that's selling them through their site. You want to go directly through the brand, through the company themselves when you're buying online like that. So you want to be careful where you're getting them from. There's also this idea of what's called third-party verification. So the FDA, which the Food and Drug Administration, they basically take off the whole concept of vitamins and supplements. They say, like, we're not going to mess with this. We're not going to be verifying all of this. So that's why you see in a lot of supplement commercials at the bottom, it'll say, like, not FDA regulated or not approved by the FDA, things like that, to basically say, like, they're basically wiping their hands clean of that. But you can get third-party verification. That is the most common ones are the USP, which is like a gold circle. There's NSF, which is a blue circle, and then there's UL, that is a verification third-party company that basically tests the supplement to make sure it is what it says it is. So if it says it's 5,000 IUs of vitamin D3, they're going to test it to make sure it actually contains 5,000 IUs of vitamin D3, and that anything else that's in there is also being identified and labeled as well. So it's always really great to get a third-party verification label of basically someone saying, yes, I tested this. I can safely say that there is X whatever supplement in here, and this is what they say it is. If you choose a supplement that isn't third-party verified, then you don't know what you're getting because there's no regulation to it. They can put anything in there, and there have been some really interesting tests that have shown certain supplements are just basically sugar pills or placebos.
Sugar pills and like ground up sawdust and stuff. Yeah. I've seen the reports about some of these. Oh.
Exactly. So it's not just a matter of getting whatever looks pretty or whatever makes the most promises. It's really making sure that it's a good brand. I also use FullScript, which is an online dispensary, and all of the supplements that go through FullScript are third-party verified. They only use really good, reputable companies that have had testing. So it's really important to make sure that you select the ones that have been proven as a good supplement.
Yeah, and we are coming to the top of the hour, so you can learn more in a blog post that Jen did on plantpoweredkidneys.com. There's also a link in the description of the video. There's also a link there to her store where you can find things like Pro-Renal Plus D and all sorts of other vitamins that she recommends, these sources. And remember, everyone, don't just go and randomly start taking stuff. Talk to your healthcare team. Find out if you need it. I like to think of supplements, and vitamins are a supplement, as you got a road. And you guys have heard this before, but I'm going to repeat it. There's a road. When you're missing something, maybe some vitamin D, that's like a little pothole. If you're missing a lot of vitamin D, you got a big pothole. And you need to take the right vitamins to fill those little potholes. Now, you don't want to take too much because then you're making a speed bump. And we're trying to keep that road nice and smooth so we can just go right through life without our kidneys causing all sorts of problems and hassle for us. So don't randomly add any vitamins without talking to your healthcare team first.
Yes, and that's a great analogy because now I'm thinking the road itself, the primary foundation of it is the food. It's the diet. It's what you're eating every day. So the supplements are just filling in those potholes. You don't build a whole road with pothole filler.
No,
although that's getting into more of like the stuff that I don't know.
Yeah, I'm a car guy. But that's it. Your diet is that road. That is your path to success, your path to a brighter, better future. And when you're out of something, you're missing a little something, got a little dip, hopefully you can adjust your diet and take care of that. But sometimes you can't. Sometimes we get these little potholes, and that's where your doctor will recommend a supplement. And it may be a vitamin, it may be fiber, it may be something else to help us. But having too little of something is bad, and having too much can also be just as bad for us. And you may be thinking, hey, I'm taking extra of this because it's good for my kidneys. And you're taking too much and you're hurting them. We don't want to do that. All right, everybody. Next week, we're going to be talking more about vitamins. We're talking about the water-soluble vitamins. A lot of you in the comments were talking about a lot of those. Some of them are very important to me. And I can't wait to have Jen here next Tuesday so we can finish our conversation or continue our conversation about vitamins. And I also want to do a quick shout out to, let me find it, Christmas, my friend here. Hey, Christmas. She lives over in Chicago. We have known each other for a long time. One day we're going to bump into each other and go out to have lunch or something once COVID's all over. She's been doing great managing her kidney disease, and it's awesome to see her making it here to a live show. All right, everybody, thank you so much. And thank you, Jen, again for being here, sharing such great information. And I'll see all of you again in the next video. Bye, everyone.